Meanwhile, the WHO now saying people are not taking the Omicron variant seriously enough, and that it's the fastest moving virus they've seen so far. This is the U.S. hit a COVID-19 death toll of 800,000 since the start of the pandemic. Joining us now to discuss is Dr. Evan Levine, cardiologist and also author of the book, What Your Doctor Won't or Can't Tell You. Doctor, thanks for coming on today. As I just pointed out, the U.S. death toll did hit a grim milestone, 800,000 people dying in the U.S. since the start of the pandemic. More than half of those deaths coming out since the rollout of the vaccines as well in our country, those 3 vaccines made readily available to the public. Many public health officials, including the head of the World Health Organization, though, is concerned that people aren't taking Omicron seriously. Take a listen to this.
We're concerned that people are dismissing Omicron as mild. Even if Omicron does cause less severe disease, the sheer number of cases could once again overwhelm unprepared health systems.
And as we know, it does no good to put out unnecessary fear into the public space there. But talk to me about the risk potentially of the U.S. healthcare system being overwhelmed by those who are now infected with Omicron.
Well, I think there's a lot of caution that we're taking here because no one knows how severe this illness will be. Potentially, and I wrote about this a couple of weeks ago, this may not be a curse, it may be a blessing. Perhaps this is much less virulent, and perhaps further strains will be even further less virulent, but more contagious. But there's an unknown here, and there's a fear that the hospitals will be overwhelmed. So at this point, with our limited knowledge, I think it's important for everyone not only to vaccinate, but to also accept the booster vaccine, which I have, to reduce that risk. And again, we're just not sure. We may look back on this a few months from now and say, wow, we dodged a bullet. But what if this is much more severe than we expect? And I understand why the WHO came out with those statements.
Yeah, we've heard with Omicron particularly that some of the recent cases are among the vaccinated, including some who are even boosted as well. So I know some people might have some questions about that. Before you answer that, if you could, here's Dr. Tedros on saying that vaccines aren't enough to end the pandemic. Listen to this.
It's not vaccines instead of masks. It's not vaccines instead of distancing. It's not vaccines instead of ventilation or hand hygiene. Do it all.
All right, so that's his medical recommendation there. Doctor, your thoughts on that, and then again addressing the fact that we've seen people who've been vaccinated and boosted still catch Omicron. Right,
we have seen patients who are vaccinated and boosted, but for the most part, they have a very, very mild illness.
That's true.
Some people barely have a cold-like illness. Do you really want to set back our economy and society for those who are vaccinated anyway and boosted just because someone may get a cold-like illness? I'm willing to accept that at this point. I am vaccinated. I have a booster. I want to go to work. I don't want to wear a mask 100% of the time if I don't have to. I will listen to all the regulations, but you know, I think sometimes some of these officials are in a glass box and they don't realize what about, you know, your child's psychosocial health and business, et cetera. And that's important for us to be very, very cautious about that. I am hopeful that people will get vaccinated, accept the booster, and try to go about their life as reasonably as possible. So I think we have to be realistic here.
I mean, we've seen these politicians who are coming out with these mandates break their own mandates when it comes to masking. We've seen them unmask. So I know these recommendations come out, but as you point out, there are other elements to the story as well, particularly when it comes to children and their health. Dr. Evan Levine coming on with the message of vaccinating and boosting. We appreciate it, Doc. Always check in with your personal doc as well. Thanks so much. Take care.
Happy holiday.
All right, coming